right? Okay. So fingers going down, make sure you wet your hand. Okay. Then you are going to get 3 pumps of soap. 1, 2, 3. Will you fail if you get 1? No. Will you fail if you get 4? No. 3 looks like a good amount, right? So now you are going to wash your hands over the sink, right? For training purposes, I'm gonna just do it in front of you guys. So the first thing you're gonna do is you're going to do the palms. So start with the palms. You're gonna go 1, count out loud when you're doing it. 1 and 2 and 3 and 4 and 5, right? The next one in between your fingers, 6 and 7 and 8 and 9 and 10. The next one, the back of the hands, 11 and 12 and 13 and 14 and 15. The other back, 16 and 17 and 18 and 19 and 20. Then you have the wrist, 21, 22, 23, 24, 25. The other wrist, 26, 27, 28, 29, 30. The nails don't count as time. The nails don't count as time. Remember, you're all gonna be you're gonna be doing this over the sink, right? Not out here. Now you're going to rinse your hands, right? So class, remember, rinse your hands very well. And then, Aaron, all of my students failed because why? Afterwards, they go like this, right? So remember, don't go like this, just drip dry. Drip dry, drip dry, drip dry. And then class, don't be cheap on the don't be cheap on the paper towel, right? How many of you have tried to put gloves on with wet hands? It makes it very difficult, right? So don't worry. Okay, keep on drying, drying, drying. And then you're gonna use a paper towel to turn this thing off, right? A lot of my students, what do they hate? They hate keeping the water running, right? Because back home, we're very water conservative, right? But for the state exam, don't worry, right? It's because if you turn the water off while you're soaping your hands, you need to grab a paper towel, your hands are soapy. So just let the water keep on running, right? Class, can you fail the test if you go like this? Oh wait, before that, how many seconds do you need to wash your hands? 20 seconds. Can you fail for washing it for 19.9 seconds? Yes. Can you fail for washing it for 40 seconds? No, right? So the more the better. Can you fail if you go like this? 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12. Can you fail if you just keep on going like this?
Yeah.
Yes, right? Why? Because you're not washing all surfaces. Can you fail if you go like this? 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9? No, because you're washing all surfaces. The reason I do it like this first 5 seconds is just like systematic, right? So you just do your palms in between the fingers, the back of the hands, the wrist, the nails don't count as time. Class, and then you want to count out loud because when we're nervous, right? When we're nervous, how do we talk, right? Huh? No, but like when you're nervous, you talk faster, right? Say like immigration, when they're calling, they say, hey, why are you flying in here? And why do you have your birth certificate with you? I don't know why, it's like fast talking because you're nervous, right? So, so when you take the test, you might count like this, 1 and 2 and 3 and 4 and 5, right? Remember, Jonah, he failed the CNA one. Jonah, he passed the second time. But Jonah failed the CNA hand washing. Because he's always so fast. So But the good thing about counting out loud, like 1 and 2 and 3 and 4 and 5, say Aaron was counting to 30, but he was counting fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. But if say I timed it and Aaron only counted for 18 seconds, but he counted up to 30, I might still pass him. Why? Because I'll say, well, Aaron, he counted to 30, so he knows he needs to wash his hands for more than 20 seconds, right? So just count slow, all the surfaces. What else? But if you fail hand washing, you fail everything.
So it's if you are doing that, you're supposed to speak louder.
Yeah, like you're, yeah.
Mm-hmm.
Just like that voice like there, today I am washing my hands, right? So, no questions on hand washing. So remember, class, they're gonna give you a piece of paper, right? They're gonna give you a piece of paper with 3 skills on it. It might say nail care, oral care, and hairy care, right? But hand washing and common care practices are implied. So you won't see it there. So when you get that piece of paper and your test starts, the first thing you're going to do is wash your hands, right? And then you were asking Rachel, so once you show them that you can wash your hands correctly, when you take the other skills, do you actually have to wash your hands again? No, right? You only have to do the universal sign of hand washing like this. So a lot of my students, they misinterpret this, right? I said to them, all you need to do is pretend to wash your hands in the future. What they will do is they will pretend, actually they'll go do it, they'll pretend like to go to a pretend sink. Then they'll say, I'm gonna get a paper towel, turn this thing on, put soap in my hand. No, it's just, I am washing my hands, right? Don't waste time on that anymore. So, just the universal sign of hand washing. The second thing I wanna show you is wearing gloves, right? So these are gloves here. There's no wrong way to put on gloves, right? No wrong way. You just put on gloves here. But there is a proper way of removing them, right? Okay. So what is the proper way of removing them? Yeah, pinch it right here, right? You're gonna pinch the outer part, roll it inside out, make a ball, 2 fingers in, and turn it upside down, right? Remember, Jonah showed you that in CPR class. If you go like this, they're gonna fail you. Some of my students will go like this. They have gloves on, so if you go like this, you will fail, right? Say you were doing peri-care. Peri-care, peri-care, peri-care. Now you are going to take the gloves off. If you go like this, right, you're gonna fail. Because why? You have peri-care touching the clean skin, fail. And then if you use this to grab the outside of this, fail, right? So remember, they're gonna be watching you how you take your gloves on and off. Any questions on gloves? If there's one time, I think it was pre-COVID, that place they were having a shortage of gloves. One time they just said, if they say pretend to put on gloves, then you just pretend. But if they have gloves there to put on the gloves, right? Class, if you look at the skills thing, right? Put gloves on every skill. You're gonna put gloves on every skill except one skill. What is that skill, Aaron?
Medication.
Feeding.
What do you?
I say you tell me that if you make medication, no gloves.
No, medication, you need gloves.
You need gloves?
Yeah, feeding,
Only
right?
feeding?
Only feeding, right? Because they don't want to think the food is dirty or something, right? Why are you wearing gloves? So you wear gloves on everything except feeding, right? Because you don't need to wear gloves on everything, right? Like head hose, range of motion, turn and repositioning. no gloves, peri-care, oral care, nail care, gloves, right? But then why are you gonna try to remember, you know, oh, which one needs glove, which one doesn't need gloves? Just put gloves on everything except feeding. It makes it easier, right? So that's just a trick. So right there on the front, say, put gloves on everything. Just right here. Oh no, put gloves on everything except feeding. Then for hand washing, can you make little notes on this? Hand washing, Jay, just put wash hands for 20 seconds, all surfaces, right? Common care practices is okay. And then, so every time we go to a skill, right, and I show you a skill, then you are going to put like the notes on what to do. Okay, so we're gonna start off with nail care here. Let me get the mannequin here.
Nail care. It's random.
So nail care is like this one is just like a medium. Like if you think weak, like just lift up.
It's healthy.
But nail care is just like, you know, if you were gonna think about an easy skill is ambulating, hard skill is like peri-care. This is like a medium, so I wouldn't be it was not too bad if you get that one. So this here, this is the remember class, we're gonna orient you, what's that word?
Orient.
Is it orient? Yeah, they're gonna show you like where all the supplies are prior to, prior to the exam. They're gonna tell you where all the dirty linens and the garbage go, where they gather the supplies. I don't have a file, so we're gonna pretend that the toothbrush is a file, but everyone knows what a file is, right? To make the nails smooth. Okay. And then lotion. We'll just pretend that this is lotion here. So the first thing you're gonna do is say, knock, knock, knock. Good morning, Mr. Mannequin. My name is Patrick, your caregiver today. Today we are going to do nail care, right? Wash my hands, put on my gloves, and then gather my supplies. Mr. Mannequin, I will be back, right? So now you gather your supplies in orange stick. Pretend that this is lotion and pretend that this is a file. Use your emesis basin as a carrier, right? And then how many washcloths are you gonna need? 4. So now you are bringing it to the client. The first washcloth is for what? A barrier, right? Then you're gonna put your washcloths on the barrier, orange stick on the barrier, lotion, and file. Mr. Mannequin, I need to go get some warm water. Now you are going to the sink, right? How do you get the water, or how do you turn the water on when you're at the sink? Because you have gloves on, you need a paper towel, right? paper towel, turn the water on. What type of water do you use? Warm water. So for the state test, you really are going to get warm water, but for training purposes, we'll just pretend. Warm water, then you're gonna close the faucet, throw this in the garbage. Now you are gonna come back into the room. Because you are stuck in the room now, you need to provide for privacy, right? Then you need to have the mannequin test the water. This one's stiff here. Okay. So remember, class, when you do this skill here, you are doing it on a real person, right? This is only because of COVID, I am doing it on a mannequin, right? So remember, I will be in front of the client, but you're gonna have the client test the water, test. The state might want to test it, right? Test. So you need to be, when you take the state exam, right, you need to be sitting down in front of the client at eye level, right? If you're standing up, they will fail you because it looks too intimidating. But for training purposes, I am going to do it standing up so you can see what I'm doing, right? But remember, for the state exam, you are sitting down. Okay, so he is going to soak his hand, Aaron, for how long? 5 to 10 minutes, right? Are you really gonna wait 5 to 10 minutes? No. After 5 to 10 seconds, you are gonna say, after soaking his hand for 5 to 10 minutes, I am going to remove his hand. Then you are going to dry his hand. The first surface, you can dry the palm. How do you dry? Pat. Then you are going to flip it. Now dry the top. Pat. Flip it, the sides, and the last surface in between the fingers. So class, okay, now this can go into the linen. If the linen baskets are movable and the trash can are movable, move it towards you, right? But if it's stuck in a wall or something, then you would just set this on the side and gather it at the end. Okay, so now this is where they're testing you, right? This is the swipe and wipe technique. So you're gonna write that on the note for nail care. Swipe and wipe. You are going to swipe under the nail going one way, right? Swipe under the nail and then Jay, wipe the dirt off, right? Then you are going to flip it. You are going to swipe and wipe, flip it, swipe and wipe, flip it, swipe and wipe, flip it, swipe and wipe. This can go into the linen, this can go into the garbage. If you swipe without wipe, they're gonna fail you, right? Because you're transferring germs from one nail to the other nail to the other. If you swipe and keep on wiping on the same area of the towel, they will fail you, right? Because you're just rubbing the dirt in the same area. So this goes into the garbage.
I want to know where you really swipe it. Is it in the?
Oh yeah, inside the nail. You know when you get a manicure?
Inside it.
Like inside, you know, like where the outgrowth is.
Uh-oh.
So not inside, like where inside, it's gonna be where the nail goes out, right? So you're gonna go underneath that. How many of you are working already? Right? A lot of you are working, right? You're working. Remember, the residents like to put their hands where? In their pants, right? You know, so in real life, that's why when I was working, you know, when I was working at the nursing home, right? I used to walk in, all the residents want to shake your hand. Good morning. Like the good morning, right? And then 1 hour, 30 minutes later, you see them digging in their pants, right? Oh my God, I said, did they even wash their hands? sometimes there's poop in their nails, right? So that is what you're cleaning out, is like the dirt. So just underneath the nail that is growing out. If someone,
Just go once.
yeah, one way, right? So
Yep.
if someone has short nails, like if the nails are very short, then you're just gonna go very gently like over the skin. If the nail is like right there on the nail bed. But some people always have like a little bit of an outgrowth. Like here, Alicia, give me your left hand. Show them your thumb. No, this. Oh yeah, here, show them that thumb. So you see your thumb? Right, you see the nail like out here?
Yeah.
That's where you clean. Okay. So now you're going to file the nail, right? This is not a toothbrush, it's a file. So when you file, you're only gonna file in short motions going in one direction. File, 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 file. This goes into the garbage. Lotion is optional. So you're gonna say, Mr. Mannequin, do you want lotion? They said yes. Get a little bit of lotion, maybe a dime size amount. Make the lotion warm. You can put it in the hands and the fingers. And what is this last thing here for? To wipe the excess lotion off. So put this in the linen. Okay, Mr. Mannequin, now I have to clean up my supplies. Grab the barrier, put it in the linen. Now, I will be back. I'm going to the sink because you're at the sink and you have gloves on. Paper towel, turn the water on, rinse, rinse, rinse. Throw it in the sink, right? Rinse, 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 throw it in the sink. Another paper towel to wipe it dry. Another paper towel to turn the faucet off. Put this upside down in the soiled basin area. You still have gloves on. You come back to the room. You remove your gloves, wash your hands, remove the privacy. Mr. Mannequin, here is your book, Bell and Water. I am, you
Done.
see, that's maybe more of like a medium hard skill. But I've done it so many times. I mean, like Jay, when you start working in an adult family, you'll never do this. Like when Alan needs nail care, you just wheel him up to the sink and have him wash his hands, right?
Yeah.
That's what you do in the real world. This is just so you can pass the test, which is unrealistic. But what is the state looking for? They're looking for that you're not transferring germs to an area. They're making sure you're having them test the water. They're making sure you're having privacy. They just want you to jump all through these hoops to see, if someone is competent to do it, right? Because to remember all this, you need some, brain knowledge to be, to be able to do it. Any questions?
I have a question.
Yeah, Alicia.
When you get water, warm water, you should by yourself touch the water.
Remember, but you're gonna touch it with a glove.
You're having the gloves.
Yeah, a lot of my students, it was weird because when they did peri-care, right, they would get the basin and then they would go like this, right, with their elbow, which is maybe, but then you're contaminating it with your elbow,
Yeah.
right? And then they're saying, well, I can't feel the water because I have gloves on.
Yeah.
You can feel it. You know if it's warm or cold, So, yeah. Or you could turn the water on. So you're gonna start wash your hands, turn the water on. You could turn the water on with if you didn't have gloves on, and then feel it before, and then fill up the bucket in real life. But just feel it. Now we are going to do oral care, right? This one is easy. This one you're going to need toothpaste. You are going to need two paper or 2 cups, toothpaste, toothbrush, how many washcloths? 2.
2.
And then a clothing protector. Remember class, you call it a clothing protector and not a bib, because bib are for
Babies.
babies, right? Oh, let me get the thing. What are you doing? Cool, you can give it extra? You want extra? No, I don't know. Knock on the door first. I just need, yeah, there's a gooey in there. Okay, so this is, right, clothing protector, okay. So once again, I'm gonna be doing it standing up, but when you do it, how are you gonna do it? You're gonna be doing it sitting down at eye level. For this one again, it's going to be done on a real person, right? So, knock, knock, knock. Good morning, Mr. Mannequin. My name is Patrick, your caregiver today. Today we are going to do oral care, right? Wash my hands, put on my glove, gather my supplies. I'll be back, Mr. Mannequin. I gotta gather my supplies. Okay. So, this is the clothing protector. Make it small, right? So it fits in the barrier.
Yeah, this is what we needed. So, okay, $95 to get new NAR. But that's for that. You haven't taken the state test yet? When did you finish your training?
Okay. So remember, use this again for a carrier, right? Okay, so bring it to the room, right? When you bring it to the room, then you're gonna put the barrier down. Then bring this clothing protector and set this down. You don't have to bring everything at once, right? How am I gonna hold 2 cups of water? I'm gonna end up spilling it. So class, now you get 2 cups, go to the sink. What type of water here, class, now? Paper towel, you're gonna get cool water or lukewarm. Good, right? Paper towel, lukewarm or cool water, water. Okay, why do you have 2 cups of water? That's sometimes confusing for the student. Okay, so now you're gonna provide privacy. Mr. Mannequin, I like your gown today. Let's protect it, right? Now you get the gown, put this over the mannequin. So now, this is why you have 2 cups, right? You're gonna get the toothbrush, you're gonna dip it in 1 cup of water. Because they don't have a sink next to you, so how are you gonna get the toothbrush soft? So water. You're gonna get, what do you call it? A pea-size amount. Put it on the toothbrush. And then water. Okay, now set this water away to the side so you know you already used it. So this is where you pass or fail again. You are going to really be brushing someone's teeth during the state exam, right? Which is hard to believe, especially with COVID, but maybe they'll have you pretend. So you're gonna brush his teeth, so you're gonna stick this in his mouth, right? But I'll show you out here. You're just gonna brush his teeth. Everyone knows how to brush teeth, right? All you're gonna do is just round circles, the right side, top and bottom. The left side, top and bottom. The middle, top and bottom. The bottom of the right side, the bottom of the middle, the bottom of the, well, left, middle, right. The top, right, middle, left. Then the back of the teeth, right? The back of the bottoms, the back of the tops. And then say like I'm brushing all the surfaces, right? Am I done? What did I forget? The tongue. Can you say right? Stick your tongue out. Brush the tongue going downward. Good. Set this on top of the water, the old water, the one that you dipped in. Then you're gonna have the person gargle, and spit, right? remember, hold it like this against the chin, not this way. At least 3 times. Gargle, 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 and spit. Gargle, 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 and spit. What is this last towel for? To wipe his mouth. Pat, 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 pat. This can go in the linen, right? All of this here, this water, Jay, pour it into the emesis basin. Pour it into the emesis basin. The toothbrush, the cups, all of this can go in the trash. Just throw it, right? You're not gonna reuse it. Then you are going to remove the barrier. When you remove it, just roll it inside out. Then put this in the linen. Now you're gonna gather your supplies, barrier in the linen. Then you're gonna say, Mr. Mannequin, I will be back. Return this to where you got it. Sink on with a paper towel. Rinse, 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 throw. Rinse, 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 throw. Paper towel, wipe it dry. Paper towel to turn the top off. Then you're gonna put this upside down, right? Come back into the room. You are going to remove your gloves, wash your hands. Then you're gonna give him, remove the privacy, bell, book, and water. I am done. So the notes you should write this: 2 cups, 1 for dipping the toothbrush, 1 for gargling, and then brushing all the surfaces.
Let me just check this real quick. I don't know why, but it doesn't ask for the NAR information. I don't know whether you printed this
Oh,
off.
maybe it's missing a
on the
page.
site.
1, 2, 3,
7, 4,
4.
See, this is new. I don't remember it looking like that.
4. You know, this is, this is weird. This is,
I might just fill out another application. It looks different. What does
oh, here, NAR.
license and, okay.
Yeah, but I would just have him fill out,
Cause I don't know who filled this out for him because he wrote this information,
Yeah, that-
so he had somebody else do it.
and it's white out there and everything. So
Okay.
have them,
Yeah.
and then make it, the email was all. Okay, so any questions on oral care, right? That was easy. Question?
Yeah. Can you please repeat how you brush?
Oh, repeat?
Which part, yeah.
So remember, so if this is, okay, so when you're brushing his teeth, right? When you're brushing his teeth, so just like when you brush your own teeth, right? You're gonna start with the, it doesn't matter where you start, but you're gonna start with the right side, top and bottom. The left side, top and bottom. The front, top and bottom. So now you brush the front of the teeth. Now you're gonna brush the bottom of the teeth, right? The bottom, bottoms, bottoms. The bottom of the top, bottom, bottom, bottom. Then you have to then you have to brush the back of it, right? Here, this is the teeth, the front, the top, and then the back. Then the back of the teeth. Then the back of the teeth. Right? And then the last thing, the tongue.
So there's
Yeah.
not like a second, how many seconds? to
No,
brush?
like, I would say a minute at least, right? Cause that's how long, minute or 2. Cause you're gonna be brushing like, but I really don't understand how they're gonna be doing it with COVID, because someone told me that like when they did the feeding, the evaluator still had his mask on, right? So, and then they said just pretend. So they might have you just pretend, right? Because with COVID, everything is so,
It's easier if it's just pretend.
yeah, it's easier if it's just pretend, but remember to brush the tongue. That's where they might trick you on. Okay, the next one is, we did oral care. Okay, the next one is medication, right? A lot of my students were failing this before. I know yawning, Aaron. Okay, so I'm gonna erase this. So Bernadette, when's your test? The 12th. Huh? Oh, we're closed Saturday. Who is the 14th? When's Rachel? Next Monday? Rachel, where's your test? Here? Here?
Yeah.
Alice, Kent? Kent?
Yes, yes.
Nancy, Saturday?
Yes, okay.
Yeah. But so Rachel, if you take the test right, because I'll be here Monday, you know, me and Aaron will still be here practicing, right? So on Monday, if you pass, when you pass, you come up here and then we will show you off in front of everyone. Class, this is one of my former students, Rachel. She took the test and passed, right? But if you fail, you go straight to the bus.
No,
No coming up here, just call me.
Okay.
Okay. So now we're going to do medication administration, right? So for example, what it's gonna do, it's gonna have 3 people, right? The first person might be Jonah, right? And then you're gonna give him aspirin, 325 milligrams by mouth, 8 a.m. The next person might be Daktari, right? Aspirin, 325 PO, 8 a.m. The last person might, and then the last person is the mannequin, right? So 325, wait, aspirin. Okay. So, class, I don't understand why, well, they're trying to trick you, right? They're giving you 3 people so that you will get confused, right? So, Aaron, if they say, give the mannequin the medication, do you even have to worry about Jonah or Daktari?
No.
No, right? But, you know, when you look at the MAR, they're never gonna have more than one person's name on the MAR, but they're trying to trick my students, right? So now, you just focus on the mannequin. So if this is the MAR, this is the information on there. Give the mannequin the medication. So just focus on the mannequin. So, so this is only medication assistant. Knock, knock, knock. Good morning, Mr. Mannequin. Today I'm going to give you your morning medication. Wash your hands, put on gloves, gather your supplies. You're gonna need the MAR, right? And you're going to need a writing utensil. Bring that in the room. Mr. Mannequin, I have to go get your medication and some water. So you're gonna go get some medication. Usually it's in a medication container like this, right? You're gonna need a cup of water, and usually they give you an enabler. Enabler is just a med cup, right? So now you're gonna get a paper towel and turn the water on, right? Paper towel, water on. What type of water? Cool water, right? Cool water, paper towel, turn the water off. Now you are going to bring it back to the room. Okay, so now you're ready, you can provide for privacy. So class, you pick up the first medication, you look at the MAR. We're giving Mr. Mannequin his med, right? The first medication, Jonah. This is for Jonah. Do I need to go on?
No.
No, so set it aside already. You don't need that. The next medication, Daktari. Do I need to go on? No. The next medication, Mr. Mannequin. Do I need to go on? Aspirin, 325 milligrams by mouth. But what they do here in Federal Way, they will leave the time blank or it's the wrong time. So if this is blank or it says 8 p.m., do I need to go on? No. So then you grab the last medication, mannequin, aspirin, 325 by mouth, 8 a.m. This is it, right? So, okay, you verified it already once. You open the medication, then you pour it in the cup, verifying it again. Mannequin, aspirin, 325 by mouth, 8 a.m. One should just fall out and it's candy. Then you're gonna close the lid, verify it again. Mannequin, aspirin, 325, 8 a.m. by mouth. Verifying it at least how many times? 3 times, okay. So now you have one of the medications here, Jay. This is what they're gonna trick you, right? When you go give the medication, right? When you go give them the medication, the evaluator's gonna do what? They're going to open their mouth, right? Say, they're gonna open their mouth. What are they trying to make you do? They're trying
to make you put.
Yeah, they're trying to
in your
make
mouth.
you put the medication in the mouth. Then what happens once you put the medication in the mouth? It turns from medication assistance to what? Medication administration, which needs what? Nurse delegation, automatic fail. So, no, you're trying, don't say no, you're trying to trick me, but I'm sorry, I can't put the medication in your mouth, I haven't been nurse delegated. You need to do it yourself, right? So now, you give the medication to the client, right, here. Well, he's holding it. Then he puts the medication in his mouth. Then you give him some water. Drink, swallow. What do you have to do after? Yeah, can you open your mouth to make sure the medication is gone? Good. So now it's the cleanup process, right? Put the medication cup in the cup. You can throw that in the garbage. Put the medication all back in. Return the medication to where you got it. Come back to the room, remove your gloves, wash your hands, remove the privacy. Then you're gonna get the pen, initial where you gave the medication, and then say, here is your bell, book, and water, I am done. Class, if they don't have any medication enabler, say they don't have the plastic cup, right? Sometimes they don't. What are you gonna do? You are going to pour it in the cap, right? So now you pour one of this in the cap. Do you give the cap to the client?
No.
No, where do you put the medication?
In the palm.
In their hand. You see? So if they don't have a cap, just do that. Then you don't have to wash their hands, it's their own germs, right? So don't make it more difficult, but they always try to trick you by opening their mouth and then the medication there. Any questions on medication assistance? There are three automatic fails, right? One thing, if you give the wrong medication, automatic fail. There's nothing you can do. If you give the wrong medication, see that? Huh? Oh, talking to Jonah?
Yeah.
Oh, Jonah's there. So, I forgot. Okay, so giving the wrong medication, automatic fail. A safety issue. What's a safety issue? Not putting their shoes on when you transfer them, right? Or infectious control issue, wiping the peri area the wrong way. Automatic fail. So, for this one, just put, check to make sure they swallowed, make sure the client takes their own medication, etc. Then we will go to feeding. Feeding is like but not like it, but very similar. What's the tray? Get the food tray. Huh?
I know the
Oh, 1977. Tray. But class, remember I was telling the story. Because before we used to not do a skills class, but remember, I told you guys the story about, Rahab. She was one of my students, right? And what did she fail? She failed feeding, right? Why did she fail feeding? She failed.
So for Peter, he took our class like last year, but
Yeah.
then he failed 3 times for the state test, retook our training, and then he's sending a new application.
Yeah.
But for the,
3 times he failed. Did you do a skill review?
I don't think so, but when he does the, what is it, the social security
Yeah.
application, because he's been here for 1 year, so I don't know, and he's already sent this application in before,
He doesn't have the social security though.
Not
Just still
yet.
say working, because he doesn't have anything.
so just saying I applied for asylum.
We're working on documentation, because he doesn't have anything.
Okay. Just working on documentation, okay.
So remember, the reason I teach this class, like one of my students, Rahab, she took the state exam, right? And she failed because she fed the student standing up, right? I said, Rahab, why did you feed the student standing up? Because she said where she works, she feeds 3 people, right? So 1 bite here, 1 bite here, 1 bite here. So my thing is, you guys need to differentiate how you do it for the state test and how you do it in the real world. If you fed someone breakfast the way you feed them for the state exam, by the time you are done feeding them breakfast, it will already be time for lunch. It's so long, so we always do like safe shortcuts. Okay. So for here class, you're gonna need, gotta find the tray, but you're gonna need a tray. Then you're going to need spoon, washcloth, cup of water. Okay, so class, the students come and they practice, but then I don't know where this stuff goes. But, so we're gonna pretend that this is a plate, right? So, when you are feeding a client, oh, and then you need a clothing protector. When you are feeding a client, they're gonna give you, like, what type of food? They're gonna give you fruit cocktail. What's fruit cocktail? Pear, peach, or cherry, right? A mixture of fruit. Or they're gonna give you like cereal, right? A mixture of cereal. Usually you're gonna have 3 selections. Why 3 selections? So when you feed the client, you are offering them alternative, right? What do you want to eat? It's not like if you're feeding fruit cocktail, you're just feeding cherry, 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 right? When we eat a meal, we always take a bite of one thing, then take a bite of another. Okay. So you're gonna go knock, knock, knock. Good morning, Mr. Mannequin. My name is Patrick, your caregiver today. Today we are going to feed you breakfast, right? Wash my hands, no need for gloves, no need for privacy. Eating is a social event. You're gonna gather your water, your food, your clothing protector, and a washcloth, right? So you're gonna bring the food to the client. Mr. Client, I like your gown, let's protect it. So you're gonna protect the client's clothing. Hi.
Nahanap po si Si Uncle Ben.
Oh, Tito Bang, he might, who is that? That's, what's his name? Archie? Yep. Did you see my uncle?
No, I thought you was here.
Oh, no, what do you need though?
Guess I can see you.
For,
One person.
who's that? Hold on, class.
Yeah, you want to pick it up or might be still sleeping.
Yeah.
It's not replying though.
Well,
We need to color hair.
George, come here.
Much blue hair is all.
Dami mong baon na. Ako, tengo ahí, ¿sí? Aquí, a mí. Zapatana. Zapatana. Ah, I wish. Itakuwa vizuri.
Okay. Where is he? Is he there? Okay.
I guess separation anxiety. He gets very upset when Oh, yeah. I mean, I'm there after. Yeah. He's probably when I'm there, I should sleep on my Yeah.
Kami nagka-license tayo sa
God luck.
dalawa na yung laga ko. Madali alalahan natin. Madali lang. Kaya lang sense version ng pero bahay. Bumalik kasi yung sukat ng door. Hindi pwede. May cut. Hindi naman kasi kailang may 2 inches na kulang. So,
Dali lang. Doon sa Manila,
oo. Dali sa naku. Shower. Ito sa akin kasi hindi naman yung bar lang.
Hold on, Archie. Hold on, class. So today, only decaf. I didn't make it. This is only decaf. I'll get some later at break.
Or even if I put them on the ground and I don't look like.
No, you hold them.
Yeah, lap dog. Looks good. Yes. I prefer that.
Dito ka tumawag sa park.
This one. So you go over all these pages. So you start with one here. Module 2.
Check your email constantly for the next month. You should send one out maybe within the next 3 weeks. Alright? If they don't, contact us as soon as possible, okay? Alright, good luck.
Now the very last page, all. But you can learn when you have your break. You work for all the hours. From morning to evening without a break. Without a break. But there are times when you're not busy all the time. Maybe in between you get.
Kasi halos yung kumbaga na yun, pala ko sa,
But you need to learn to, in order to pass, you need to know some of the
Still recording. Stop it.